one of the good, sometimes a useful way to think about this is that size of employers and the context that you're in. But one word that comes to mind is scope. That's often a barrier, either because the organization is small, they have not done any of this yet, or it's big and therefore it's massive if we're going to do something. And so that seems just so big that then people freeze, just like any sometimes larger projects that we as individuals look at, right? So the scope seems too big. And so what needs to happen, what people need to remind themselves, is even if you see all the good reasons and you know all the ways this could be done, like perhaps even the person earlier who was asking, what do I do now? I almost hear the enthusiasm behind it. We still need to then scale it back to what could be a first step so that we move away from this scope that's too big that then paralyzes us, right? So to scale it down is very, very important. Another barrier, I mentioned it a bit earlier, is that people will get buy-in of whoever is there now in leadership, and then leadership changes. And therefore, one of the challenges is that the commitment goes away. And for this, I'm going to bring us back to an earlier part of our conversation and the importance of starting the movement from the ground so that more people are involved, so that a change here is not as impactful. We've spread the engagement, we've spread the efforts and the enthusiasm around it. So the buy-in is another one. Another roadblock I mentioned also earlier, but it's a key one to keep in mind, is this one's a bit more for larger organizations where you'll have different cultures, subcultures, and different teams. And therefore, the broad brush sometimes will work well for everyone, but sometimes it needs to be different. Sometimes we need to work with certain groups more than others because that's where more of our disability is, perhaps, or whatever, right? So we can do a combination of supporting everyone so that the healthier groups stay healthier and become even healthier, right? And at the same time, pay attention to where our groups that need most help are and do that. So that's a roadblock, as in, if you don't do that, then you're missing out an opportunity. Two more. Another one is, that's also one that goes into be specific, is to make sure, sometimes people go so broad brush or so recipe almost that it's not perceived as sincere from the employee population. And so taking the time to, when you're thinking about your strategy, what's going to go in it, to think about your organization, that culture, and what's going to resonate, what's going to be seen as sincere in terms of actions and programming. And then the last one is the last roadblock is, again, we've touched on this one, but it's to try to go at it alone. Big mistake. It is big, but not, even if you were able to take it all on, it's not a good idea. You already have partners that are also taking care of the mental health of your employees, like your employee and family assistance program and your insurance carrier, for example. You want to bring them in. Otherwise, you're going to be doing a silo strategy here, and it certainly won't be as efficient as if you would bring all your partners. So these are some examples I hear often.